flu. It's getting bad. Some emergency rooms are slammed with patients hit especially hard by the virus this season. Just in the last hour, the CDC updated this situation. The Fox Medical Team's Beth Galvin joins us now. Officials are already talking about an epidemic potentially?
Yes, Dana, I think a simple way of putting it is we're in for a doozy. And we're already seeing a doozy of a flu season.
Terms.
Exactly, because if you take a look at a map of the U.S., the brown indicates states that are seeing widespread flu, geographically widespread throughout the state. And the CDC says this is the first time in 13 years every state in the continental U.S. is being hit with geographically widespread flu, and they're not sure how severe this flu season is going to end up being. But the more common strain that is making people sick right now, and that's the influenza A H3N2 strain, is linked to more serious illness. The agency says 7 more children have died from flu complications just over the week leading up to January 6th. That brings the total number of pediatric flu-related deaths to 20 now. They're also seeing a jump in hospitalizations in younger children 5 and under and people who are over 50. So what about the effectiveness of the flu vaccine? The CDC says their early findings show that it offers about 30% protection, or somewhere in the 30s. Now, that's not very good for those of us who are counting on our flu shot, but it's much better than the reports that we were hearing out of Australia, which just finished with its flu season. And there, the vaccine proved in studies only 10% effective. So flu seems to be peaking right now across the United States, but the CDC cautions that we could still have 3 more months left in our flu season. So health experts are saying it's not too late to get your flu shot. It is far from perfect, they admit, but they say at this point it is all we've got in terms of protecting ourselves. That, Dana, and just staying away from people who are ill and washing our hands a lot. Don't touch your face. All those common sense things that mom tells you.
We had a guy come in the office the other day and say, I think I've got the flu. We could not have kicked him out faster. So there's that option. But what do you do if you start to feel sick? I mean, I think I would ride it out at home, but I don't know what to do.
Well, I would say the first thing is stay home. If you can at all, avoid going to the ER. Avoid going to the emergency department, because right now they're really crowded. Unless you're very severely ill, you're going to wait a long time and be pretty miserable there. That said, if you do develop really severe complications, or you have a child who develops complications, or somebody in that high risk group, the very young, the very old, anyone with a chronic illness, you may need Tamiflu. And Tamiflu is an antiviral that's better when it started early. So do go to the emergency room if you're chronically ill, you have a weakened immune system, or you're showing really severe symptoms that you don't think you can ride out.
Right. Flu is one of those things that you think you just ride out, but it can kill you.
It can.
All right, Beth, thank you so much.